Hey, this is Van Crisco. I'm an interventional cardiologist with First Coast Heart and Vascular Center. I want to talk to you today about diagnostic heart catheterization, get you to understand what's involved in the procedure, and walk you through the steps of the procedure here at our cath lab, what to expect. I'm going to show you step by step how we'll proceed when you arrive, the access strategy, the diagnostic imaging, and hopefully give you a better flavor before you arrive about the procedure and all the aspects of care. Hey, this is Dr. Crisco again. We're here at our outpatient cath lab. I'm going to walk you through and show you the facility and what to expect. You're in our waiting room, and the check-in people right here will take your name and information, and family members can wait out here until we take you back. When we go back to the holding room, family members can follow you. This is one of our typical pre-procedure holding rooms where we have the bed, the monitor, where we check your blood pressure. Here you'll get intravenous access for IV fluids. The nursing staff will prep the access site, which is either the wrist radial artery or the femoral arteries. We'll put you in a gown. We'll make sure the vitals look good, and the nursing staff will go over all of your medicines with you and what to expect for the procedure. We get consent updated here if we haven't already. And then from this particular site, we go back to the cath lab for the procedure. Recognize that there are multiple cases here in a day, and that if you arrive before procedure, sometimes we ask you to arrive early so we can hydrate you with normal saline to reduce the risk of problems with contrast. Also, sometimes we'll move forward quickly if you don't need any prehydration or anything like that, and we're able to get your case done early. Recognize too, sometimes interventional cases here take a while, so sometimes you can be delayed, but we try to make sure we move forward in an expeditious and safe fashion. This is the heart catheterization table. These are the controls. Once the patient gets on the table, they're typically prepped and draped in a sterile fashion. We either expose the arm or the access sites in the groin, and then once the patient's on the table and prepped and draped, we give some moderate conscious sedation to help people relax through the procedure. This allows then us to proceed with getting access either in the radial artery in the wrist or in the femoral artery in the groin. Recognize we like radial access because it's shown to be the safest and easiest access strategy to get a catheter from a peripheral artery to the heart to do imaging, or from the radial access to put a catheter in the aorta to image from the aorta to the feet. Alternatively, we're limited by sometimes the interventional strategies from the wrist, especially for the peripheral arteries. From the coronaries, it's fine to do a procedure both diagnostically and interventionally here from the wrist access site. Once we get access, we typically do it under ultrasound guidance. We place the catheters where we need to inject the iodine contrast. Typically that provides a warm sensation for the patient depending on where the contrast is delivered. And we get imaging of the heart in multiple planes, imaging of the aorta and the rest of the body if needed, depending on what you're sent here for. At this facility, we perform diagnostic carotid angiograms of the carotid arteries in the neck, coronary angiography, looking at the left ventricular function, right heart catheterization as well. We image from the kidney arteries all the way down to the feet if needed to look at the arterial vascular supply. And we can certainly fix blockages here as well if needed. Not everybody needs something fixed here. Many things can be managed medically. Certainly if patients fail medical management, they might need revascularization. Sometimes we come off the table to talk about the results before we proceed with fixing a blockage, for example. Other times, if the patient's aware of the blockage before we get here, we'll go ahead and proceed with fixing it while they're here. Once the procedure is complete, patients come off the table and go back to the same holding room where we started. There, they recover. It depends on the access site, either closure or ambulation status can be assessed so we can get up and move you around. We typically feed you lunch, and then we go over the findings with you. Many times, patients will be referred to consultants from this facility, either to see a specialist or subspecialist about further assessment of some medical issue, or to discuss options related to therapy. the patients are often referred out of here as well on new medicines, and the nursing staff will go over that with you. This essentially describes the procedure from start to finish, what you can expect at the cath lab, and our facility will be adding on some subsequent imaging here to show you both the location, what to expect on the outside of the facility, and links to maps so you can understand how to get here, how to get home. Recognize we want people without food in their stomach, so we ask you to have nothing by mouth except your medicines within about 6 hours prior to the procedure, sometimes the night before. The nursing staff will go over blood thinners with you if they need to be held, and then sometimes we add medicines on the way out, and we'll make sure those get to your pharmacy. We'll arrange follow-up with our staff and with your primary care doctor as well, and then the consultants will make referrals. Thanks.